welcome. Thank you for being here. I would like to ask you some questions about your culture and the difference compared with the Netherlands, and about the healthcare in Netherlands and your country.
Okay, I'm ready for you.
Thank you. So, first question, what is your name?
Patrick.
Okay. And where are you from?
Slovakia. The city of Komárno.
Komárno.
The broad of Hungarian.
Okay.
Word.
Okay, interesting. And can you tell something about yourself? Just short.
I'm 37 years old, almost.
Okay.
Till 36, yeah.
Okay.
I'm working here approx 7 years in Netherlands. I worked before in England.
Okay.
4 years in Manchester. So I got skills for everything almost. And I'm working abroad because it's not good situation at home in Slovakia. So I'm here for money, just only for money.
Yes, I understand. Okay. So you come to the Netherlands for work?
Yes.
Okay. What do you like the most about the culture of your home country? Or don't you like anything about your culture?
Nature,
Nature, yes.
relax,
Relax. What's relaxed? People are relaxed, or?
hobbies, and everything is about nature, yes. Because we got Danube is everywhere, yeah. I all the time walking over Danube,
Walking.
and with child, with wife,
Yeah.
easy.
Okay. So the
Because
life is different.
Yes,
there.
definitely, because there is more stress, big life.
Yeah. Okay. And what do you like less about your culture? If there's anything.
Maybe opportunity.
Excuse me?
Opportunity for here is more opportunity in Netherlands.
Yes.
Of course,
Okay.
and choice
So
with hobby, with everything, of course. Because Netherlands is more skillful country, like Slovakia, of course.
okay, I understand. Okay. And do you think there are major difference in the culture between your country and the Netherlands?
Yes, of course. Here is here in Slovakia is Christian culture, 99%,
Okay.
and here is a mix.
Yeah. Okay. What do you think about the Dutch culture?
Dutch culture.
Yes. What do you think about it?
Almost say like England, strictly rules,
Much rules, huh? Okay.
and I think so same. But here is more culture. Here is more cultures, because in Slovakia is only Christian, and here is much. I don't know which. I don't interesting, but I know it more.
Much different people in
yes,
Poland.
yes, of course. And I think original culture from Netherlands, like 100 years ago,
Yeah.
is almost gone. I think so.
Yeah. Yeah. Okay. And what is the difference when you think about deadline if you work? If you have a deadline for your work, so they say you have to do something and on that day it has to be finished, is it for you like it's really the end, you have to finish something, or okay, we have to work, it's like...
Sometimes, of course, if we
it's
are
a
busy,
guideline.
and the situation is very heavy,
Yeah.
or independent about situations, of course, sometimes we need to do,
Yeah.
but usually it's easy, of course.
But if you have a deadline, it's more like a guideline from, okay, we know how long we have, or it's really they have to finish the job. Is it strict, or you don't think?
Sometimes I say sometimes yes, sometimes no, but 80% is more easy, like strictly, of course.
Okay.
But usually we are non-stop, of course, overnight, overday. Independent about cargo, about the customer, about ordering. Of course, this on the ship is different job, like on the land. It's definitely 100% different.
Okay. But if they give you the deadline, do you think it will be a problem in your mind for you if it's 1 or 2 days after this deadline?
No. My mind is free all the time.
Okay.
So doesn't matter. Because
Okay. Okay. And if you work, do you prefer to work with a planning or are you flexible?
flexible, of course.
Okay.
Because every minute is different situation, independent weather.
It's dependent on the situation.
Yes.
Okay. Are you rather honest and very straightforward, even if it maybe hurts someone's feeling, or do you try to satisfy others? It's about your
So.
personal.
It's so, you know. Again, it's about situation.
Okay.
Because every person is different and every situation is different.
Okay. Do you think it's important to work on business relationships during and after working hours, or do you like to keep work and private life separate?
I think so, separate.
Okay. And do you prefer to work individual or in a group?
Sometimes in the group, sometimes individual.
Okay.
Independent of the situation. Some jobs is for alone, some jobs is for crew.
Okay. Do you like to work with a group or?
Yes, better of course, because it's safe and healthy.
Safer, okay. And can you explain when it's nicer for you to work alone or in a group? Can you make an example, maybe?
If you do the bigger place or bigger job, of course it's simple for a group.
Yeah.
But if you do a special job with engines or I don't know any small parts for practice, of course it's better alone because you have a guarantee for this job.
Okay. And what do you think about the way Dutch people express their emotions? Is it different in your country?
Yes, of course. Independent in land on ship. Of course, on the ship is people is a little bit different like on the land, of course.
Okay.
But on my country, yes, definitely.
Yeah?
Yes.
Can
it
you
is
tell me a little
more
bit?
strictly, more precise.
Maybe they don't show their emotions so fast as
and,
Dutch people.
less funny.
Less funny?
Yes.
But I think maybe in Holland it's easy to show what you feel. Is that in Slovakia also the same or different?
Different, yes, of course. In Slovakia you got only one exercise and you need to do. Here is more steps, more what do you mean? More training, more training for situation, and we have here more exercise.
Okay. But is it in Slovakia normal that people can cry? People can see it?
Yes, of course.
Okay.
It's normal,
Okay.
like here.
Okay, that's safe. Okay. If you hear bad news, do you involve it to yourself and try to do something about it, or do you blame others for it? Maybe a higher power, your religion?
Independent about situation, about question, about the bad news.
Yeah.
This bad news is then a slice of bad news. I don't know. It's many is bad news.
For example, if you become ill,
Yes.
well, do you think it happens for a reason, or is it just something happens in your body where you maybe can do something about?
Independent about ill, about ills, because ills is sick and psychical or mentally, you know, it's different. So, but usually, of course, to do with doctor, with group, with people talking about this.
Yes.
It's not no. I don't do it alone with the problem because we have doctors and professional team or people for this.
Yeah. So I think it's really medical.
Yes. Yes, of course.
Yes. Okay. Okay, now some questions about healthcare. Do you come in contact with healthcare in your home country?
Yes.
Okay, what do you think about the healthcare in your country?
Good.
Is it good?
Good, but not good.
Why good and not good? Tell me more about it, please.
Because approx the last 10 years, very good people, doctor and sisters goes abroad working.
Okay.
Because of course abroad is maybe 4 or 5 is bigger wage, like at home. So at home stay only standard people, you know?
Yeah.
Basic people without good skills, without good care.
Yeah.
Of course we get good care, but it's not professional care, you know?
It's not the best because the
Of
good
course.
ones leave.
Yes.
Okay. And do you came in contact with the healthcare in Holland?
I didn't have because my health is good,
Okay.
so I am still good and I don't need help because don't have
You don't
accident.
need it,
I
yeah.
don't have accident or injuries or something.
Good news, okay. So you don't know the difference. In your country, do people communicate in the waiting areas of the doctor or in hospitals? Do they talk to each other when they're waiting, the patients?
Yes, of course, some department is direct to the doctor, some department you need to visit and you need for calling because sometimes it's maybe for hours, few days,
Sure.
independent about department, you know.
Yeah. And if you're waiting with the patients
Yes,
before you can see the doctor, do
yes.
these people talk to each other? The patients waiting?
Yes.
Okay.
Somewhere is smaller, somewhere is bigger,
Yeah.
independent about department.
It's not
yeah.
like
No.
people
No,
talk
no,
to
no,
each
no.
other. Okay, great.
Friendly.
That's nice. And if you're having health problems, who would you prefer to see first? Your family or a doctor?
Independent about injury, of course.
Yeah.
So easy injuries is normal, like with basic pills or standard health. If you got a bigger problem with health, of course you go not to the doctor or yes.
Okay. And the last time you made an appointment to see the doctor or nurse, how long did you have to wait for the consult?
Independent about in vestibule, you know, sometimes 5 minutes, sometimes 2 hours. Independent about patient, how many is inside.
Yes. So if you call like, I'm sick, I would like to see the doctor, you can go the same day, mostly?
You don't need calling, you go on direct to doctor, and independent about situation, if there is few patient, wait.
Okay.
And if there is many patients, so you spoken with sister and you got telephone contact and then you have an appointment about independent about injuries, of course.
Yes.
If you are heavy or
You
drunk,
can go fast.
yes, of course, you have an
Okay.
emergency.
Yes. Can you give your opinion about the recommended treatment? So if the doctor say, I think this is a good treatment, can you talk about it, or the doctor is really in charge?
Yes, of course, independent about the doctor, every doctor is different. So somebody is normal, you can spoken together about diagnosis or problem. Somebody is strictly, yes, of course, if he is strictly, I plan for the next doctor.
Okay. Was it explained to you what the doctor was going to do last time you visit the doctor, or is it just this and no explanation?
Last time I've been in complete about blood, you know.
Yes.
So I've been on the complete about blood, you know.
Yeah.
All groups and all numbers and all details about your blood.
Yeah.
I had complete and it was good, so I'm good.
Okay, that's nice. That's nice. But the doctor explained good to you what he was going to do?
So yes.
Okay.
Yes.
And do you feel taken seriously and respected by your doctor?
Yes.
You picked the good ones. And do you have a health insurance? Is it normal to have one in Slovakia?
Yes, of course. But it's working together with Netherlands, Aegis.
Okay.
So that was is communication together and of course don't have a problem.
Okay, good. And in Slovakia, can you choose your own injury provider? Your insurance provider?
On name or?
Yeah, can you choose which one?
Yes, of course. We
Okay.
have 3 or 4. Yes.
So that was the last question. Thank you very much for your time.
Nice to meet you.
Yeah, the same. Thank you.